Welcome to this session on contactless patient care, the future. Thank you for listening to me, Manuel Justice, the product head at Agile Health. At this time of pandemic, while most of the sector has been impacted, it is the healthcare professionals like you who stand in the front to fight. Is this safe? And how can technology bring about adaptability to the new norm as it is put today? This question has propelled hospitals and healthcare providers towards a contactless future. Keeping in mind the safety of the patient and the provider alike, the contactless patient care was thought to be a distant future. However, COVID 19 has brought it closer, pushing the technologists and the healthcare providers to work hand in hand. Now we are at a point where we've come to terms to live with COVID. It is time for us to invest in technology to set ourselves up for a long term success with contactless patient care. In order for the risk of disease spread to decrease, newer innovations had to be made. With network infrastructure readily available, we had to make a contactless solution readily available and deployable quickly. Not only that, at an affordable cost for both the providers and the patients. Today, patients are concerned about visiting a hospital. They just do not want to come in there for the fear of COVID. But what is more worrisome is the situation of delayed detection or action leading to complications. How do we make it safer for patients to reach out to doctors and win their courage? What do technologists have to offer to address this? Well, today's technology can make your hospital contactless by extending most of the in-hospital services to patients for them to acquire wherever they are from even the comfort of their home. Technology can enable most of the at-home hospital services seamlessly. With the penetration of mobile phones in India increasing day by day, it is prudent to have a mobile app and bundle all of the contactless services and at-home services into the mobile app. But that's simply said than done. Till date, it is the appointment booking through websites and mobile applications has been the near contactless experience that we've been able to provide to patients. But it is time for us to move beyond this and consider reducing hospital visits by patients. It is imperative that these services are offered in an integrated manner, that the patient feels comfortable that all of their medical history is available for the doctor and the patient to refer together. These extensions are absolutely necessary for enhancing the doctor's experience as well, while we do that for the patient. Let me walk you through what is available for making your hospital contactless. Reaching out to doctors, care providers, and patients through video collaboration. This technology is now available at a reasonable cost. Through this, doctors can gain access to patients. But do they really get access to the data? Well, an integrated EMR can enable the access to data of the patients, providing the near in-hospital experience for patients and their attenders to digital ICUs or remote monitoring is another extension of the technology. While all of this can be done, we can extend this to provide monitoring patients at home and enabling sample collections from home as well. Hospitals can choose to offer these services as bundled offering a few of which I shall describe below. At the center of it all is the video collaboration platform that allows doctors, nurses, care providers, and patients to see each other and collaborate. Let's take the example of a typical video consultation with a patient when the patient shares his or her test report during the consultation. And now you notice certain abnormalities in other areas, and you really want to have a quick opinion from a specialist colleague. You should be able to bring in the specialist on demand, provided they are available, and get their expert opinion while you still interact with the patient. This will significantly improve the patient experience and reduce the visits that the patient really has to make to the hospital. Of course, today this is possible through such video collaboration platforms at a reasonable cost. Such platforms integrated with hospital management software and doctors' applications can significantly enhance the reach to patients and provide them with personalized care. With the video platform at the center, hospitals extend their consultation as telehealth services. Well, that's the beginning of contactless patient care. The push towards contactless care is likely to continue through virtual appointments in primary care, urgent care, disease management, and behavioral health. Telehealth is not just about video or telephone call with the patient. It is about the collaboration between the patient, the doctor, and the care provider. Of course, this will not make any sense without data. In order to bring the interactions closer, we need to access the medical records of the patients during the call. This is possible with an integrated EMR, which actually can bring in the video into the EMR itself. How is this possible? Well, it is the interoperability of all of these components that are accentuated in order for us to accomplish this. While the patient experience at hospital was the measure earlier, we now need to ensure we bring the same experience for the patient remotely. This calls for complete collaboration platform that will provide patient the confidence and the experience to come back. Right. Having looked at telehealth, let's now look at how the video platform can also be extended to offer tele-ICU and remote monitoring. With accessibility to patients at the ICU already being restricted, and in this COVID times, patients admitted are monitored from a distance, even within the hospitals. This brings out the need for monitoring patients in the ward from a command center, providing doctors the safety and the confidence to perform their duties. Imagine if the patient is in the ICU and his or her relatives are asking for an update or a status. This was earlier possible only by meeting the ICU doctor at the hospital. However, at this time when this is not possible, we can enable this through technology, allowing the ICU doctor to interact with the relatives with live data from the ICU monitors. Yes, bring in the connected devices. This is possible by interoperable devices being connected to the EMR and showcasing it through their video platform. Does this serve all the contactless services? Well, you can now extend this to offer home-based care. The pandemic response has created momentum around patients with chronic illness and patients needing post-surgical care to limit their hospital stay or visits. Hence, It is essential to extend the care at home. This is feasible with doctors and care providers reaching out to the patients through the video platform, reducing the physical contact with patients. Enabling seamless home care remotely has become the need of the hour. With the advent of mobile applications, it is possible that the patient or the attender is able to engage with the care provider, the doctor or the nurse, through just the phone. Today, patients are also equipped with medical devices at home. For example, they could carry a pulse oximeter, glucometer, or the blood pressure gauges. Leave alone the very wearable devices that have become more accessible these days. This enables patients to self monitor and report some of the vitals and are able to record them as advised. While integration of wearable devices has been explored for doctors to gain access to the real time patient data remotely, it is still a long way to go. The challenge behind this is the interoperability of the devices and the systems. The proprietary protocols adhered to by each device manufacturer is making it difficult, but the pandemic is pushing us hard. These interoperability challenges are expected to be addressed in the next few months or years rather than decades. It is this environment that we are moving toward, and we feel contactless patient care is here to stay and is the future. While today's need has driven many innovations, time is set for consolidation of these platforms and ensuring interoperability of medical devices and the operational software. Healthcare technology, which has been cautious, has now received the long needed push to catch up with the rest of the sectors. And we see interesting times come sooner than later. Let's embrace the new technologies without fear and enhance contactless patient care. We at Agile Health have launched our patient engagement platform and service delivery platform to enable contactless patient care for you. You can reach us at agilehealth.in. Thank you.